So I'd like to welcome all of you and thank you for coming to our session. So maybe earlier today you had the opportunity to listen to a brief presentation that I gave about population health data NL. Now I'm also joined by Roel van der Heijden, who will in a second be able to introduce himself. And the way we've envisioned this session is that we can go through a bit again the highlights of population health data now, but the most interesting thing for us is to understand kind of questions that you had, suggestions that you have. We can also highlight some future opportunities for interaction, also at different conferences, but also maybe in working groups or whatnot. So we would like to keep this actually as interactive as possible, yet roughly on topic. So that's a bit the challenge that lies in front of us. So maybe you can just take 20 seconds to briefly introduce yourself.
Yeah. So my name is Roel van der Heijden. I'm working for the Aletta Jacob School of Public Health. I have a background in setting up public-private partnerships in health and in technology. And well, together with Jochen and a couple of other colleagues, we have been working on this population health data platform or initiative that I think we already started more or less 1.5 years ago, already 2 years ago, I think, with the whole idea behind it. But I think last month, it really has taken a flight, among other reasons, but the support of Health Thrive. And I think, as Jochen mentioned, it's ongoing. It has quite some backup from these national-oriented parties. But what we are really, well, as maybe will come forward from your presentation, Jochen, we do not focus on. We try to do as less new things as possible. Try to reuse as much things that are already there. And I think with setting up this platform, there are also in the Netherlands, but maybe also abroad, there are already quite some other initiatives from which we can learn and which we hope to, in some sort of way, connect to our initiative that we can learn from. But Jochen, I think maybe introducing maybe shortly your presentation again. I think it's good for everybody to get on topic again on the subject.
So as soon as there are questions, just butt in with your questions and we can go to them immediately. If you already have questions, just go for it. So as I was saying earlier, so population health data NL basically has arisen from the kind of from the demand that's there to move towards data-enabled health. Now, Ega at the end did a bit of a semantic exercise in the difference between data-enabled and data-driven health. So the reason why we always call it data-driven health is because in Dutch, the word enable is really nasty to translate. Enable actually has a very nice word in English, which in Dutch doesn't really have a good counterpart. So then we always end up with data gedreven, which then translates to data-driven, but we mean more data-enabled. And what we see in the public health domain is that really there's so many opportunities where there's different kind of data platforms that are being arisen. Different people are linking data, often in the regional and local context, asking very similar questions. So actually, one of the ways that we came up with this, we have a bit of time for anecdotes, is that we had the running gag in the office when the first moment would be in a week that some municipality would send us an email or call us to understand what the health situation was in some area that they were interested in. And usually this was Monday before noon. And they all have kind of in splendid isolation these questions, and our idea was, we have to bring this together a bit. And that's also where we noticed that there's so many parties dealing with data collection, but not really generating insights. There's also many that are really dealing in a kind of non-use case driven way that start linking all kinds of data. And then you ask them, okay, so what is the question that you want to answer? Well, we link all the data and then we find a question to answer. But that's, as a scientist, of course, you always find that, but from a policy perspective, it's a bit trickier. So that's a bit the background of how we want to build this up, with this kind of idea that we have these three pillars of an infrastructure, a display, and the learning community. And I think that's really what we want to achieve, because it's not just about the plumbing behind the wall. It's about what you do once the water comes out. And that's where the display and the learning community are actually very important. And the way that we're trying to actually build this up is to start really with the societal question that's there. We also mentioned it a bit in the presentation, these use cases. So very concrete things, right? So one of the things is this population health management project, where the question basically is from the funders is, okay, over time, we want to evaluate whether or not this new way of organizing healthcare in this area has decreased the costs that we are making for healthcare. So we need to have a platform to do that. And similar in the Northern Netherlands, we have the Nationaal Programma Groningen, where the national government is investing 1 billion euros to enhance welfare in the province. And the question they have is, okay, in 10 years' time, when we're done with this, what was the consequence of that for the health and well-being of the people? And this question is always kind of there, and it's very hard to answer. So it's these kind of questions that drive us in developing this. And as I said, there's this kind of nice apps. Yes.
Jochen, can I ask a question?
Yeah. And
about the public
Marco,
infrastructure?
can I ask?
Sorry? Oh.
Yeah. Marco, can I ask you one thing? Because I know who you are, but because we don't have a big round for introductions, but everybody who asks a question, just 5 seconds, say who you are, where you're from.
I'm Marco Spruit. I'm a professor in advanced data science in population health at Leiden Medical Center. My question is about the public infrastructure. So this is this only federated architecture underneath, or is it also including, or is it able to connect with the CBS-like centralized data infrastructure? Or is this one of the open issues?
Well, it's an excellent question. It's a semi-open issue. This morning, actually, before the conference, we had a 1.5-hour session with the CBS to discuss exactly this.
Okay.
And also the question, and there we also put forward the question of, now if you look at the CBS environment, it's either open or the RA, and there's not really a gray area in between. But if we look at kind of examples from abroad, for instance, in Germany with a socioeconomic panel, they have a kind of nice funnel. So there's some data that's open, just there for everybody. Then there's some data you need a login code and they check who you are. And then there's some data where they really check who you are and it's no longer a login code, you have to have your fingerprint. And then there's some data that you can only access if you're kind of in a confined space in Berlin and you basically have to go in more or less naked so that you don't take out anything. And I think these kind of shades of gray in the middle is something that we can also think about, and we're thinking about together with the CBS, because it's not always that if you don't just use the open data that you immediately need the RA. There's quite also some questions for in between. So I think we're also thinking together with them about indeed the RA environment and how we can link that and also see how we can use that here. And there's a kind of CBS in the box, but also maybe to have some intermediate steps where you say, okay, I want some more fine-grained data, but it's still sufficiently safe to do through through a secure environment, but not a remote access environment. But this is something that we're developing now, and what I would really like to invite you, if you're interested in this, because the way we are now developing it throughout the spring and in the fall, is we have kind of different working groups thinking about architecture, thinking about linking with end users. And then if you have those kind of questions interested, then it's always interesting to join up also, with these architecture thinking groups.
Okay, it's a very current question. All right.
Yeah, and I think it's at the heart of the matter. I think it's something that we all think about, right? Other questions, by all means.
Well, maybe the Groningen, the big Lifelines project that is that uses Health RI federated approach, right? Or does it also include CBS?
Yes. So at Lifelines, of course, you access also through a remote access environment, as you know, and then through there it can also be linked with the CBS data. But the CBS data, then the Lifelines data is, I think, moved to the RA space. So then you're in the CBS environment.
Yeah. Okay.
So because the CBS doesn't send data anywhere, so then basically there's a link between the Lifelines environment that then pipelines to this to the RA environment.
Okay, thanks.
Cool. Any questions there, guys? If there's anything moving ahead, we can try to answer them. So I think that here the important thing is we have these three pillars that we are now developing further. And I think what's interesting to know is kind of the the use cases along now. We are thinking of developing it further, and we're also always looking for new ones. And the thing is that it has to be something concrete. So there has to be a party that's really working with this, that has this question, and imaginative use cases are always important, but they have little bearing on reality. So by getting into these concrete use cases, we also try to find where the real issues are. So the one that I mentioned before is the evaluation of population health management in this CAVO model setting that also, of course, LUMC and others are involved in. Then in the northern Netherlands, this neighborhood twinning is something that we're working on. So every neighborhood has a twin. So if you take the 13,000 neighborhoods in the Netherlands, then for every neighborhood that there's a neighborhood that's almost exactly the same, but differs on some aspects. So for instance, there will be two neighborhoods that have the same composition in terms of income, in terms of education, in terms of ethnicity, in terms of age, and then one is really healthy and one is not. And then by using, like, let's say simple AI algorithms or kind of propensity matching, those kind of things, you match those two together, and then okay, maybe we should just go to one of these neighborhoods, and then you can start connecting qualitative approaches of just going there. So apparently everybody's healthy here, even though in another neighborhood that's very similar to this, people are not. So what's going on? And then we can learn from that. But we can also use them as synthetic control groups, because of course in population health, we cannot do experiments, but then by using these kind of synthetic control groups, we can say something a bit about the cause and effect. And the third one that we're thinking about is more for youth care. So the question, of course, is kind of what could be done to improve the well-being and health of children and adolescents. And there's a big data problem because of the decentralization. This has become kind of ultimately federated, and then the data linkages are tricky. So we're talking to some parties about that have brought this up to bring this up. And I think from what we essentially try to do from those use cases is try to get together. So what's the question that you want to answer? What's the demand on data that's behind that? And how does that demand on data that's behind that overlap between the different use cases? So that at a certain point you can say, look, if you have a data infrastructure that can do roughly this, then you'll be able to answer different types of questions instead of having a data infrastructure for every different policy, separate policy field. So that's kind of how we are thinking about developing this. And as I said, we have this nice consortium with various parties, of course, Health Arrive, CBS that we mentioned, the Health Ministry, the NFU, various universities, and then in the kind of the regional settings, the municipality of Groningen is, I think, is an important partner because they're trying to push the image of the city of Groningen as the health data city of the Netherlands. This is something that they've brought up to themselves. So that's kind of how we are moving forward.
I think what is in this specific setting with Health Arrive, which is nice to mention, is that Health Arrive originates, of course, from more research-oriented approaches, and as has been explained at the beginning of the conference, is that the Health Arrive is, of course, also working on this this proposal for life science and health within the Groeifonds. Now, Groeifonds, it's essentially also about the economische. How do you call it, Jochen?
The earning power of the country.
Sorry?
The earning capacity of the country.
Thank you very much. You're an economist, so that's why you know this. No, and I think in that perspective, it's also really important from such an organization to think about in ways where we can valorize the wealth of data that we have nationally, regionally. And I think that's also why population health data now has become a significant part of the project proposal that is currently in this Groeifonds project. And as Jochen mentioned, we are one of the parties that really sees these governmental organizations as your really main stakeholders to make an impact in the region on health. But at this point, there is no organization that in that sense facilitates, or another more academic-oriented or knowledge institute-oriented organization that facilitates the governments in that sense, the governmental organizations. So yeah, well, in that sense, I'm also really interested in the process of setting up population health data NL, and that we're also currently in. We did a lot of use cases in the Netherlands where we saw people that more or less have the same questions and spend the same budget on making the same basic infrastructure. But actually, we're still really open to all of these initiatives that are currently in the Netherlands. So we have quite an extensive list. But I really hope that in this session we also would have maybe participants that can tell a bit more about the initiatives that they are involved in and how that it could link with population health data now, because then we would be really happy and eager to connect you to us. So I hope this does not result in a blank in some white noise. But is there anybody that could say how this initiative would link to his or hers current projects, for example?
Lucy.
Yes, so for me, this is the first time I hear about this initiative, so I'm not sure yet. So I have some questions. So I'm Lucy Overbeek, project manager of the Healthy Brain Study, a study here in Nijmegen. And what we are doing now is, together with the municipality of Nijmegen, we are exploring which societal challenges, societal questions they have, and how we, with our research, with our network of researchers, can answer their questions. So, we are in the phase of exploring. So how could this help us? Because I already know from the first meetings that with our data, we cannot answer all these questions. So then I would look for other resources, etc.
And while talking to the municipality, do you then also see that they have clear the questions that they have? Do they already have an idea on what kind of data sources they would be needing to?
No, they have clear questions, but no idea about the data. That's my impression so far.
It's a very common picture, which we also got in.
Yeah, and I experienced quite a gap between the municipality and the researchers. And with this project, one of our aims is to close that gap by just starting collaborations and trying to answer their questions. But I hope that such a platform and the network and the activities and the learning community could help us, because I think I'm not the only one trying to do this.
No. Could you elaborate a bit on the questions that you have articulated with the municipality then at this point? What kind of things do they have? What they would like to, from the health domain or the well-being domain?
Mm-hmm. So in general, they say what they want to change is that at the moment, or that they always react to what's happening in the community with the citizens, and they want to change that to that they can more anticipate on what's going on. So that's in general terms what they want. But for example, in Nijmegen there is, I think, similar to other cities, that there is a large part of people in the bijstand, and of course they have unhealthy behaviors and also poor economic. So it's more than only health. It's the whole context in which they live. So and that also requires that interdisciplinary approach of researchers. So it's not so, I can go to the lifestyle researchers here on campus or to the economic people. So they have to, and with this study, we made this network on campus. So that's, I think it's our advantage, or at least which we can start to answer these questions from a more interdisciplinary approach.
Yeah, so if I listen to it, so this is the case. This is actually the question that we come across very often. That there is, that there's a set of issues that are not solved simply by having the data, because you could send all the data there is to the municipality and they would look at you and have no idea what to do with them. So it's really about that they want certain insights, and those insights have a demand on data. And I think it's up to us researchers to translate the questions that they have, which are often quite vague. So we also see that here in the north, right? The municipalities come and they say, okay, look, we would like to make the citizens of our municipality healthier. And you say, okay, and what do you mean by that? Well, we want to make them healthier because that's what we said in our electoral program, and that's what we're doing here. Okay. And then that's why I think this learning community and also this kind of display is important, because there's quite some kind of, there's a bit of a supply chain, starting from the kind of vague questions that municipalities have, to translate them to articulate those questions into, let's say, actionable questions that you can actually answer. Then from those questions go to, okay, what does this mean for data? And then from those questions go to, what does that mean for the data infrastructure that you need? And in the end, our experience here in the north is that these municipalities are not even interested in this infrastructure that's there, as long as their question is answered. Mm-hmm. And that I have the feeling that sometimes we try to, over-educate the municipalities and societal stakeholders, whereas maybe by keeping part of it, by just doing what we're supposed to do and making sure that they get their insights, we're a bit better off. So having also some more non-technical oriented people collaborating with the municipalities, who can then communicate themselves with the more technical people on the back. And I think in Nijmegen, as far as I know, there's quite some interesting things also going on together with the public health group. At least I talk to Pim Assendelft relatively often. So I think it's also, I think, up to us researchers to make consortia that can answer questions in a kind of set way. And I think that's also in this populational data now what we're trying to do, is that it's the insight that's central. And how that insight is delivered is not so important to the person that's delivered to, but we have to organize the thing in the back. So I think moving towards data-enabled work is so much more than just having the data infrastructure. And I think there's so many researchers struggling, or not struggling, but engaged with the question that you asked, that having this learning community where you learn from each other how to do that can already be quite a help, because there will be many people who have been in a situation that you're in. So for that, it would be nice to, maybe we could organize in one of our learning community sessions, just a session dealing with the outside world.
Yeah, and also the other way around. So for example, we have this resource now, and well, we just offered that to the municipality. So here you can answer your, and then they don't know what to do with it. It's just, then they have data, and that's not the way they think. They think from their, what you say, from their programs and their goals. So to match that, so maybe even matchmaking, or how you translate their questions to the data you have, and which is available on a national level.
Yeah, I think that's what we have to learn with each other, that in the end, of course, municipalities maybe need to learn a bit more about data, but in the end, they're not going to become data experts because they're policymakers. And I think it's important that within the realm of being a policymaker, one needs to learn to work from data. Roel, do you want to add something? Marco, I see you actively thinking.
No, it was not. It had a different reason. No.
Okay. No. So what I wanted to add maybe is that it's nice, Lucy, to hear that you have this in Nijmegen, such a more regional orientation, which could, in that sense, connect to the population health data platform, which is going to be like a national platform. But a lot of the things happen in the region itself. And that's also in Groningen, for example, so that you have these cluster organizations that can actually translate the regional questions. And we foresee, well, it's health arrive, hub and spokes model. I think from the population health Netherlands, we also see more or less this kind of model, that you have regional stakeholders that are able to take up the questions for a whole region and then can interact with such a platform. So I think you have some capacity building at your own place, in your own new organization or entity that you want to establish, as we are doing in the Northern Netherlands. But at the same time, those can also interact with a broader community of such entities. I think that's really like a nice approach that we have in the platform. But also in that regional network that you have, that's also what we're doing, and maybe can also be something for your region. But you also have a lot of advisory companies. So you have a lot of these adviesbureaus, like consultancy firms that advise governments in how they should set up their policy, for example. But what we see is that they also require more often, they would need to have more access to specific population data, so they can enrich actually their products to give better advice to, for example, municipalities, and hence indirectly we can contribute to the impact that these kind of parties can make on health. So for us, I think the model is absolutely not exclusively for research, but also has a strong focus on the partners that can help us to make the impact in the region. But of course, well, that gives a lot of, it raises a lot of questions on, okay, how can we have a public data infrastructure, which, for example, has the CBS data in it, but how can we then have a modus operandi, how we can work with these kind of parties together to, while they have more, maybe like a commercial benefit to it. So I think it gives a lot of questions on how, but it's the nice thing that we see is that also the CBS this morning, in that sense, they really want to explore how can we make how we can do this valorization of the data better to make impact. So they don't want to set up 10 times a week the same type of data set for 10 different municipalities. So I think that it's a really nice movement that we're currently setting up. I'm going to post, because I know we have to keep track of time, but I'm going to post already this copy paste, which has a lot of channels where you can find additional information, and maybe because people always do this in the last 10 seconds of the session, and then they cannot copy paste it anymore to their own email or I don't know what. So in the chat we have quite some information for everybody in the call to already check. But Jochen, you want to respond?
I want to ask Jochen one more thing, because it connects to what you were saying, Roel. You mentioned the German infrastructure, which has this data classification system in place. Is there a documentation on that, a paper or something? Or
yeah, I'll send it to you if you drop me an email.
Yeah.
So otherwise, if you Google ZERP and DIW. And otherwise, drop me an email, which would be a good idea anyhow. Okay. It's the end of the session. Thanks, everybody. Thanks, of course, Lucia and Marco, for your many questions. The others, thanks for listening to us. Sandra, thanks for your excellent suggestions. So Roel shared some links on how to get in touch. We really want to see this as an open and collaborative project. It's not about excluding others. It's about how we can all benefit from all these data that we have. Better, of course, for society, but also for research. So thanks, everybody. I wish you all a nice afternoon, as much as left of it, and I'm sure we'll see each other later. Goodbye.
Okay, thank you.
Bye-bye.